For more, we welcome now Dr. Omer Awan, physician and professor at the University of Maryland School of Medicine. Dr. Awan, wonderful to have you this morning. Thank you. You know, I wanted to kick things off with comments from RFK Jr. on the White House helping rural hospitals keep the lights on. We have a clip here.
It's going to be the biggest infusion in history, and it's going to restore and revitalize those communities. And we can't survive as a nation if we don't honor our rural communities.
So, as you know, many rural hospitals, they've closed because of low patient volume. How will MAHA specifically plan to target those facilities most at risk?
Well, it'll be interesting to see, Kelly, because rural hospitals and areas in rural America disproportionately have lower and decreased health outcomes. You know, you're more likely as an American to have heart disease. If you live in rural areas, you're more likely to have diabetes. You're more likely to be obese. So, you know, I know that Secretary Kennedy actually in a recent tweet has said that they're going to increase funding by 50% in rural areas. And that is, of course, much needed. And that will certainly improve health in rural areas. But the real issue here is how is this going to be implemented? And that will be really important to see as the day goes on. How will this be implemented? Because we need more hospitals in rural areas. We need more physicians in rural areas. And we certainly need patients and Americans that have access and have transportation to these health centers so they can improve their health.
That's right. And I think the question becomes, you know, is this one-time funding sustainable? Is it scalable to other areas as well? What are your thoughts on some of those points?
Very challenging to know because, as you know, with the big, beautiful bill, Medicaid has cut funding to rural areas significantly. So, you know, it's almost like a paradox, sort of what Dr. Frieda was saying earlier. You know, you have Secretary Kennedy telling us that funding will be increased by 50%, but there have been massive cuts to Medicaid and insurance and hospitals through the big, beautiful bill. So really, I'm really curious and interested to see how this will be implemented. But if this does get implemented and there is a significant amount of funding, I think this will have very positive waves and effects for healthcare in rural America.
Will be interesting to see a lot of dynamics at play here. We also know the Governor Abbott, he's already signed one of the most aggressive MAHA initiatives yet, requiring the food industry to either remove more than 40 harmful chemicals and additives from processed foods or add these warning labels, also removing junk food from SNAP programs. So what are your thoughts on some of those moves and their effectiveness overall?
Well, I think overall it's going to be a positive feature for public health because, as you know, a lot of these artificial dyes, additives are linked to chronic medical conditions. You know, ultra-processed foods are associated with obesity, getting diabetes, and heart disease. So the fact that these are being instituted, it increases awareness for people before they purchase items. It gives them sort of a mindset to think about what they're putting into their bodies and ultimately, hopefully, curb chronic conditions. And it's a major problem, Kelly. Remember, you know, nearly 3 in 4 adults are either overweight or obese in America. Millions of Americans have diabetes, and nearly 1 in 3 adults have prediabetes, which puts you at severe risk for getting diabetes. And of course, we all know that heart disease is a leading cause of death here in America. So a major problem that definitely needs to be addressed. And this is just one way and one opportunity for this to be addressed in the future.
Yeah, that's right. It is a problem that needs to be solved. And then you have others saying, some critics saying, you know, this is taking away choice. We shouldn't be doing that. So a lot of back and forth on this one. Dr. Awan, thank you so much for the breakdown. Great to see you this morning.
My pleasure. Thanks for having me, Kelly.